Welcome to Functional Roots, where whole body wellness begins in the mouth. I'm Amanda.
And I'm Heather, and we're hygienists with a passion for all things holistic, functional, and naturopathic.
This isn't your average dental podcast. Around here, we dig deep, past the plaque, and into the powerful connections between oral health, the body, and the way we live.
So, whether you're a fellow dental professional, a wellness enthusiast, or just someone curious about taking a more natural approach to your health, you're in the right place.
So grab your favorite herbal tea, settle in, and let's get to the root of it all.
Excellent.
All right, Heather. So, what inspired you to become a dental hygienist, and how has that journey evolved?
My journey has evolved immensely. So, I ended up going into dental hygiene after getting a divorce and moving back in with my parents as a single mom. So, I needed to find a career that I could make enough money to live on my own and support myself and a child. So, that's where I kind of started. My mom was a CNA, and then she transitioned into a position where she was in a oral surgeon's office, and I had the pleasure of shadowing there and helping out, and was fascinated with oral surgery, which I still love to this day. And I've always had a really great passion for hygiene once I got into the hygiene program. So huge into perio. I've worked in all realms of dentistry, including periodontal, practices, worked as a DSO, director of hygiene, heading up the hygiene protocols, and then ended up in holistic dentistry where I fell in love with the oral microbiome. So that's been kind of my journey. I currently don't practice clinically anymore. I do something completely outside the box of dental hygiene, but I work for an oral microbiome testing company named Bristle Health, and I work with practitioners who are using salivary testing, and I teach them how to utilize the test and provide better care, thinking outside the box of just the oral microbiome. So it's super fun. And yeah, there's a fun journey ahead. I do oral health coaching on the side privately now, and I own my own company. So completely still in the depths of dental hygiene and all of the stuff, but I'm independent and practicing on my own, and I get to do my own thing. It's kind of teaching hygienists how to do some of that now too, which is super fun. What about you, Amanda? Tell me your journey.
Okay, I have follow-ups before we get into my journey. First off, you're basically living the dream, especially for our perio hygienists out there. I don't think I ever realized like the niches within dentistry. I'm not a perio hygienist. I am 4346 all day long. But hey, to each their own. Like I love a good bloody situation. I'm like, we're gonna make this so much better. But you are getting to do microbiology in the dental space. And that is like, honestly, micro was my favorite. In doing all my prereqs, micro was my favorite. So you're getting to do one of the coolest things. And definitely, I am excited to learn from you on this journey that we're on. So don't hold back on that. Also, a note, I just remember day one of dental hygiene school. There was 24 students in our class, and there were three ladies, older ladies, in our class that were like, when I graduate, I'm leaving my husband. And it was the weirdest thing. I was like, this is your plan? Like, does he know this? Like, what? Yeah. Three out of
Yeah.
24, they were like, I'm leaving my husband for this or after this. And I was just like,
Wow.
okay,
It's
not my career goal, but
it
it is a
and
good field.
it's
It's
a
a good field.
wonderful field. And I think it wasn't just the money that was appealing. It was like I wanted to be a mom. I only wanted to work part-time because I wanted to have that be a base. I have three kids now, and hygiene is amazing because you can work part-time and make decent money. And I wasn't making what people are making now, but it was still great back then. So I think it's a wonderful career. It's very science-based, and I love science. Love it. I thrive in the science side of it. So microbiology is my jam, and talking about two-minute growth of factor alpha and all the interleukins and teaching people, about the systemic side of inflammation and how that causes disease is super fun for me. Yeah. I
Uh,
I would make Mrs. Schley super proud, my perio
oh
teacher.
my gosh. Okay, Noriana, Perio Pocket Queen. I think she literally wants to do a whole slideshow presentation focused on Mrs. Sly, and going down into the pocket. So you guys can do that little brainchild together. Okay, my journey. So on that note of how did I get into hygiene? Healthcare wasn't on my radar per se. I actually wanted to, I think I was thinking like computer science or information technology, but like pilot. I thought being a pilot would be the coolest thing ever. And my dad was like, that's not a good idea for you. And so he kind of nixed it for me. And I'm not stubborn enough, but I probably wasn't passionate enough about it, because of that very reason, the quality of life. You make great money as a pilot, but what kind of home life do you have? And, it is a very specific lifestyle with being a pilot. There's really cool opportunities to travel, and I do love to travel. But my dad at the time was just like, I don't think that'd be good for you. So he did not encourage it. I went away to college for a whole week at Eastern New Mexico University, hated it, super flat, didn't let me take my car. So I crumbled and said, okay, I'm ready to come home. So I came back home. I felt like a complete failure that I was living at home at 18 years of age, even though I pretty much lived at home until I was 24 after that. Anyway, my dad was like, well, you're going to go to college. Like, that's not an option. So I think my mom came to Portales, picked me up on a Thursday, and Friday I enrolled at the University of New Mexico Valencia campus. College credits were $32 a credit hour. $32 a credit hour. Plus we had the New Mexico Lottery Scholarship. So, yeah, if you made a 3.5 GPA, you basically got free college. So, like, I know, right? Like, why would you not? Why would you not? So that is what I did. I literally kind of had a cry out to God moment because I had never considered any healthcare, much less dental. And in that genuine cry out, like, I don't. And I was like, she seemed happy all the time. So why not? Yeah, and it's not that I didn't really have any dental, no strong dental influence in my life, I should say. I have a cousin that was a dentist, and I think she bought me one of those Play-Doh dental sets where like you put the white Play-Doh into the jaw and it oozed up like teeth, and you
Molar.
could drill on them. Yeah, the molars. That was probably the only influence I had in dentistry, and that was like maybe when I was 10 or 11. Nothing strong, but yeah, so I applied to the University of New Mexico, one of 24. I got in the first time around. I definitely did not feel passionate. Like, I think the whole time I was in hygiene school, I was like, this can't be real. Like, this is what I need to do what she was doing. Like, are we getting the same education? Are you kidding me? Because it seems so easy, right? Like, hygienists make it look easy.
Yeah.
Um,
It's hard. It's a
you
hard,
gotta know a
hard
lot.
program to make it through.
It
I-
is. So I definitely remembered questioning, like, am I actually going to use this? Do I need to know tooth bud anatomy? Is this a thing? This is really a thing? Yes, crazy. So made it through. Worked at quite a few, honestly, primarily cosmetic offices, as odd as that is for New Mexico and for working rural. I I kind of bounced around a couple like part-time. Like I worked at multiple offices at the same time. So I was getting a lot of different perspectives on things. And I don't think I ever really settled into what being a hygienist is as much as I did, what does this practice want me to be? And that is a huge difference. I moved to Utah. Marriage and COVID moved me up here 5 years ago. And I started working for a DSO. And that is the first time I've ever worked where the dentist wasn't my boss, much less his wife had nothing to do with my life, which was nice. So it really was a huge difference. And I grew into, oh, this is what being a hygienist means. And DSO's pros and cons. But I will honestly say, like, this is really where I've grown into my own. I've been given the space to grow and really take ownership of who I am as a hygienist. And I regret nothing of it. And then I would say within the last 3 years is really where I've kind of started to step into the holistic space. I mean, this could be a whole different conversation, but kind of post the health journey that many of us, I think, are on right now. It's not uncommon to hear people say, yeah, we need a change in how we're doing things, not just in
Mhm.
dentistry, but in healthcare. And I think the same thing is happening right now in dentistry. Unfortunately, Nevada is in
And-
the hot seat right now.
and
There's a lot of very cringy things happening around the country in the space of allowing dental assistants to do anesthesia. Thank you,
Yeah.
Oregon. And allowing them to do supragingival scaling. We all know that's nonsense. You absolutely cannot do that. So I think there is going to be, gosh, such an interesting time depending on how Nevada goes. And I think we're all following that pretty closely. But I think it's an opportunity for hygienists to really lock into who you are as a hygienist and not to be a tooth scraper. This is a very
Absolutely.
strong time to make those arguments of like, no, this is what we do. If you just want an office that's going to buff and puff, that's your choice. You're going to reap those consequences later on,
And
unfortunately.
and we have to advocate for our patients as well. And I think that's what's so fiery right now.
Yes.
As someone who is so passionate about making sure that we're diagnosing disease and really dealing with, the root cause of what's happening with our patients to provide the best care possible. I don't think compromising care by on the job training. When what other field do people go to school for 4 years for an associate's degree? Like you have 2 years of prereqs before you go into clinical, and then you have to pass a board and a written and a clinical board on top of it. So it's rigorous what we've all been through as a licensed dental hygienist. So it's just not acceptable. Yeah, I'm hoping that we really get some resolve on the Nevada situation. It's
Yeah.
fiery right now, and hygienists need to unite as far as that political thing kind of manages that, or we need to be independent practitioners. We just need to be put
I would love that. I
into
think I would
a
love
phase
that.
where we can practice independently. I personally would love that because I'm working with Bristol Health and the understanding with the systemic side of things, and a lot of functional doctors and naturopaths and chiropractors that are actually using salivary testing to get to the root cause of what's going on with their patients systemically. It opens up an entire career path for hygienists where maybe we would have a little bit more respect in that perspective. I think there's more for us in the roles that we can do. So if we could practice independently, maybe we wouldn't be in a dental setting at all. Maybe we're working with cardiovascular
Right.
doctors and chiropractors and functional medicine doctors where we have our own chair and we're treating the biome for the sake of the health of the patient and the not just oral but the systemic sides of things. We have a powerful knowledge and skills that can be used outside of dentistry, and if we could practice independently, I think we could advocate and be able to do more of what I'm doing. And I hope to
Yes.
inspire hygienists to understand we have the power, we can do it, and I'm doing it, and there's other hygienists who are also going down that path as well. Yeah, that lots of political talk there, but
I
it's
know.
been a
I
hot
know.
topic this week.
Oh my gosh. Yes. And definitely not where we intended to go,
No,
but
no, not
there's
at all.
there's definitely, again, we want to thank the doctors that recognize and appreciate hygienists, that we are such an
Absolutely.
important part of the team. And I mean, I know I do lunch and learns, and even you come in contact with doctors and they're like, how can I empower my hygienist?
Oh
How
yeah,
can I bring this to my team? Those are the doctors that I don't think the ADA are listening to.
I'm really
They're
surprised.
it's so frustrating
I
because there's great ones out there. There are absolutely great ones out there.
I'm connected with doctors all over the nation with what I'm doing. And they all are relying on the phenomenal hygienists to do the salivary testing and implement excellent care. And I know for a fact a lot of the ones that I'm connected with are not for training assistants
Yeah.
or training anyone off the street to do what a hygienist does. It's like taking a nurse and saying we have a nurse shortage and we should just on the job training for a nurse. I think there's more doctors I think that oppose it probably than what we're hearing, and we really need to get together with those doctors as hygienists and start advocating for the rights of the patients first.
Right. Right. What is this going to
It
do to public
it's
health?
compromised patient care. It's like there's going to be so much disease not getting. And as an oral health coach, I see it all the time, in all honesty. Like at Bristol, I provide salivary coaching so anyone can come through Bristol Health. I also own my own coaching company, and there's so many people who aren't aware of the disease process that's taking place in their mouths already, that we have underdiagnosed disease. So I can't imagine if hygienists weren't in the field anymore, how much disease would go undiagnosed when it comes to periodontal disease. It's heartbreaking. it's it breaks my heart. That's the route that the and I think a really great solution would be in Wisconsin, we have four, I think maybe five dental schools or hygiene schools. And if we upped the education and ability to put out more hygienists, maybe that would take care of some of the shortage issue they're complaining about. That's another whole aspect of it. But I have a friend who just graduated this past weekend, and she did all her 2 years of prereqs, and she waited 5 years to get into her 2 year hygiene program. So
Oh,
5 years to get into a program, and there's three close in this area. If we can't get people in after 5 years, a lot of girls or boys, guys, whoever, will leave. They're not going to wait 5 years to get into a program. So how about we increase the educational programs and open up more programs so we can provide more hygienists who are licensed and certified to treat patients? That seems like the logical answer to me, but
yeah. Never is less education the answer. I
never.
think that, yeah, like I want my surgeon to have just a little less education, preferably straight trained off the streets would be ideal.
And that's where I think I'm excited about having the podcast, because we have the ability to also add on to that education, because what we get in dental hygiene school is such a base. It's such a base that there's so much more to learn.
Yeah.
And my passion and love for biologic, holistic, biomimetic, however you want it, functional dentistry has been looking beyond just what we were taught and diving deep into gut health and nutrition and systemic inflammation and diabetes and the things that are driving disease beyond just bacteria. And I dive deep into the bacteria. That's my jam. But sometimes the oral microbiome can tell you it's not the bacteria, it's a systemic issue that's going on, and we need to deal with that. And I think the biologic functional side is really embracing that whole body, putting the head back on. And that's where you're kind of tying some stuff into. You, like me, have done the IAOMT holistic certification. So you kind of dove into that educational perspective. But tell me a little bit about your new education that you're getting into and how you're going to tie your functional nutrition degree, which is so exciting, into your practice.
That is the question. No, I am excited about it. So I started after, oh gosh, I think RDH under one roof this last year. I just got even more engaged in the alternative space. It's when I kind of started the HIOMT journey, and I was just like, I just want to know more. Like, functional just makes sense. Like, why are we just putting band-aids over things that we've been kind of thinking, oh yeah, this is fixing the problem? Well, does ibuprofen really fix your headache? It'll make it go away, but if you're getting a headache, like, why are you getting the headache? And the same with any problem in dentistry. Like, if you're getting cavities, oh, the answer's been, oh, put fluoride on it. You need more fluoride, less sugar, more fluoride. And it's like, clearly we're not doing something right when we still have the highest amount of decay in the world, yet we have the most fluoridated products. So, like, is this really the answer? Just questioning those things. So, anyway, so yes, I did start a program with the Institute for Functional Medicine. They have a functional medicine coaching academy where you just are like water hosed with information and lectures. And gut health really just is absolutely paramount to oral health. And the more that I'm studying it, and Heather, you know very well, like, we can't treat one without the other. We really can't. We know periodontal disease more than likely has an autoimmune component to it. And we're not working with providers to get autoimmune under control. But we're over here scaling and root planing and tell patients, oh, you just need to floss more. We need this. You need this product, that product. And maybe they do to a degree, but we're not taking into consideration all of the factors. We're really just, scaling and root planing and hoping for the best.
Yeah.
There's just so much more that we really should be doing for patients that want that. We want to advocate and educate as much as possible because not everybody is on this page. Not everybody is on a health journey, and I recognize that. I'm not here to force anybody to believe anything that I do, but I'll show them, like, this is what I've seen. We know these things are connected. We've been talking oral systemic for decades now, but we're not thinking like systemic oral either. And that's kind of on us in dentistry. That we haven't really taken into consideration of that. And backtracking a little bit, I did have my own health journey a little bit post-COVID. Just probably the most unhealthy time in my life was COVID. Just the isolation and just the stress of like the what ifs and not knowns, and then moving and all of these things like job insecurity, all of those things during COVID was just incredibly unhealthy for me. And then I moved to Utah, which is like the crunchiest state I never knew. But we are home to doTERRA and Young Living and Just Ingredients, all of these things. So I definitely started having patients that slightly called things into question, and it just kind of started this whole domino effect of, what are we doing? We're eating food that's sprayed with poison. We're eating meat raised in the most inhumane way possible that's not sustainable for anybody. We're drinking water that has insane amounts of toxins and poisons in it. Good grief, what is going on? And so just looking at ingredients, I mean, we talk about the MAHA movement, regardless of how you feel politically. I think we can all come together. Like, we would like things to be less toxic and less poisonous. Yeah. There's no reason for the ingredients that are in so many of our food products. To make something shelf stable, you got to do something to kill it. If it's shelf stable, it's not living. What is it doing for your body?
It's not real.
It's not real.
And that leads to nutrient deficiencies.
Absolutely.
Like, we have an overfed, undernourished population right now with rising diabetes epidemic,
obesity, the whole thing.
Yes, it's horrific. And I agree. Like, with the SRP and that, and even with caries, if we have a poor diet and we're not nutritionally sound, we're gonna have disease processes.
Exactly.
Bone loss or decay in that perspective. So yeah, awesome.
No. So all that to say, I am going to be finishing up my program in the fall, and I definitely would like to kind of marry the two and be able to reach as many patients as possible that kind of like, this strikes a nerve with them. This is frustrating. I do everything I'm supposed to do. I brush, I floss, but I'm still losing bone. I'm still getting cavities. Why? it's a frustration. I just had a friend from high school that reached out on, she just like did a vent on Facebook and she was like, I've just had my second root canal and now they're thinking that they're gonna have to pull the tooth and I just keep getting cavities. Why, since I had my kids, are my teeth just girl? And I was like, message me right away. So I'm like, I would love to work with you. Like, there's things that we can do. Let's help you. So I would love to be there to be that resource, to be that support. I still love clinic. Do not get me wrong. Especially, I'm 4 minutes away from my office. I get to work in the community I live in. I still work for that DSO. I have a lot of freedom. Both of the doctors that I get to work with now are like brand new grads. So like I'm like the old lady in the office. And I'm like, yeah, I will be crotchety if you cross me, pal. Just kidding. No, I work for two wonderful doctors with two wonderful doctors that understand that I'm crunchy, but they understand my logic and reasoning, and we can all agree we want the best for the patient and we want to give them, as good of treatment options as we possibly can. So I know they're both fresh out of school, so fluoride is still the gold standard. Chlorhexidine is still the gold standard. Thank
Oh.
you. Thank you, University of Utah. So I'm like, okay,
I'm
you can
hoping
give
we
out
can change
chlorhexidine, but
minds
I'm
with that
not.
too.
Yeah, he'll figure it out on his own. So that's kind of been our thing. But so yes, so that's I don't know exactly where that's gonna lead, but in September we'll figure that out, Heather.
Awesome. I'm excited because I don't think you can have a hygiene conversation without tying the gut and the airway into what's going on with
Yeah.
the mouth. Yeah. So I'm excited. I see more hygienists doing what you're doing, where they're getting some additional training on that nutritional component. So, and that's where diving into the root cause is going to help our patients
Yes,
get improved care and
absolutely.
improved disease processes. Awesome. I'm excited for your journey.
Well, thank you. Okay, what about you though? How did you get into the crunchy granola life?
Ooh, so funny story. I started pretty crunchy. Like I grew up in Maine. So I live in Wisconsin now,
Okay.
and I grew up pretty poor. So I'm the first college graduate in my family.
Congratulations. Me too.
Um, it's awesome, right? And I grew up without power until fourth grade. So my parents hunted and we canned, and I've sort of embraced that my entire life. I love to garden. I love the outside and I love having my hands in the dirt. And I do a ton of canning. I probably look like the tinfoil hat person where I have all the canned goods in the basement from my garden for the winter. But I've always kind of had that more holistic side of things. And then, too, COVID was a huge change for me as well. I felt a little burnt out. I was in a position where I was in charge of the hygiene protocols, and some hygienists aren't like all of us. And it was challenging to get them to do the protocols. And I guess I hadn't realized, because I practiced at such a high standard, that there are some that maybe aren't practicing at the same level.
Mhm.
So that was really challenging. And I met one of my dental soulmates in the DSO, and she came from a biologic practice. So after leaving when COVID hit and we all had to like be done for the 6 weeks in dentistry, it kind of made everybody reflect on what we were doing. And I left the DSO position and I went into biologic practice and wanted to do more because she had given me a little bit of insight. And when I used to work traveling for the DSO, I used to listen to a podcast called The Biofilm Factor, which totally jammed out with like probiotics and the oral microbiome. And I was like, this is what I want to do. And I was trying to incorporate some of those in, but I needed to be in a setting where people were open-minded enough to start thinking
Yeah.
about those things. So going into the holistic practice, I was super blessed with a doctor who wanted to make some changes in his hygiene department, and when I get there, I was like, do you have a guided biofilm therapy program? And do you have a microscope? And I kind of like did some research. Like these are the things that I would love to do if I was working holistically. So he let me kind of take charge and change up how he was practicing.
That's an amazing opportunity.
It was I super blessed. He was super supportive and just saying like, you're the hygienist, you do you. I don't like I'm not he didn't love hygiene at all. Like he's fantastic at what he does as a biomimetic dentist. He's like the best dentist I have ever worked for, clinician wise, and
Sounds
super
like.
supportive on like you figure out what you want to do. If you want to, do nutrition, you get the education, I'll help you like do that perspective. And then I started salivary testing when I had a microscope. And I didn't really know what I was looking at on the microscope. So it was really hard transitioning with the IAOMT and the certification. It was before they really launched a lot of the new classes that they're doing. So I got certified, but there wasn't really a foundation of like, okay, now this is how you can practice more holistically or biologically. So I kind of floundered for a little while. Like, how am I going to practice now? How am I going to make this different? And they're doing a much better job at getting some good CE classes out to start training hygienists how to think outside the box and treat more holistically with ozone and looking at the whole systemic connection and looking at the biome for that perspective. But once I got started with bristle and the staff was that I was working with were like, yeah, we're not going to do any more stuff. Like, we're done with, if you want to go down the nutrition side and you want to do all of that, like you do you, but we're like capped out on what we're willing to do. And I was like, that's fine. Okay, that's good. I ended up going to Bristol and now I get to teach all of the foundations that I've learned through my journey through the IOMT and all of the other CE classes and reading and research that I've done. And I get to teach practitioners how to read the oral microbiome. And it's really cool when you have a test that can tell you whether you have the host component going on or another systemic, because Bristol's different than all the other tests. And do you mind if I kind of dig in a little bit on that perspective?
No, go
Okay.
for it. This is a
So,
taste of what's to come,
yeah.
everybody.
So the Bristol test has the beneficial bacteria, which is super important to understand how your garden's growing. Your mouth is like a garden. So if we don't know where the good bacteria are, then we have no idea what the garden actually looks like, right? So we have a good bacteria score, beneficial bacteria, gum inflammation score, tooth decay score. We have a halitosis score, a gut impact score, a nitric oxide score. So you're going to understand the ability of the oral microbiome to break down dietary nitrate into nitric oxide, which nitric oxide is so important for both oral and systemic health. And then a diversity score, which I could have a whole conversation about diversity, but that's really, really important because there's some crazy bacteria in the oral microbiome that will completely overtake the entire space of the biome. And it's not periodontal pathogens that you're typically used to. So there's some crazy ones that I've seen as high as 97% of the space. So 97% of your entire mouth is taken up by this one bacteria. And I'm working with Karen Plymell through functional health. And we're working on some of these really cool cases. And a lot of her cases are those radical diversity issues. It's super fun. It's totally tied to systemic health. But Bristol's the only one that can show that. So you have to deal with the diversity issue, and you have to, if you don't have the pathology, and you can SRP to your heart's content if you don't have periodontal pathogens in there. But if you have a gut impact score that's crazy and out of control, then well, we probably have a leaky gut, leaky gum problem and some vitamin deficiency issues, which we refer to people like you to help with that component, right? And then the nitric oxide score can walk you into the airway component because that's highly tied to mouth breathing and sleep apnea. So you're looking at the whole picture. And then there's a really cool test on the market now that I just have to oral genome is a
Yeah.
completely different test. So they check for PG, which I hardly ever see. It's there. We all love to talk about PG, but that one looks at the host component. So it's a chair-side test that we can look at the diabetes risk. You have to do a diabetes and a carry screening chair-side, which is awesome. A pH of the saliva, a nitric oxide score. So Bristol looks at the ability for the oral microbiome to break down nitric oxide, but this test actually is looking for the nitric oxide. So there's two different functions that you're looking at there. And you're getting your insulin. So you're looking at the host component. The other really cool marker they're testing for is MMP8, which MMP8 is a key marker for tissue breakdown. So it's correlated with staging and grading. So if we have
Right.
MMP8 in there and it's high, you're at a really high risk of tissue breakdown. So combining those two things together would be so cool. Super cool. Okay.
Yeah. I mean, just such a more comprehensive way to practice.
Yeah.
Like, I get to practice with AI, and
Mhm.
it's been a game changer for case acceptance. But this is just another tool, like, you can show patients, like, A to Z, we know this is doing this and doing this, right? Patients are not used to going to the dentist and having testing done, but you go to a doctor and you expect you're going to lose some blood that day.
Yeah.
So it just really is, I think, catching us up to, I don't want to say catching us up to the medical counterparts, but this is such a good functional tool because it's root cause.
What
It's
are you
saying,
treating?
what are you treating? You don't know.
You
We are
can FRP to
testing,
your
don't
heart's
guess.
content. Yeah.
Yes.
If you're not, SRP isn't always the answer to everything. Yeah. So
Not always the best answer
yeah.
because we don't know.
Right. We just don't.
Because you don't test.
Test,
We
treat,
don't.
and retest so you know what's going on and find the foundation. And even with the caries, right? Like going directly to what you're doing for nutrition. Like we can have the bacterial issue, or we can have a mouth breathing problem and a dry mouth and a salivary problem that's driving disease. Acid reflux can be a causative, going back to the gut, or vitamin deficiency. And the MAHA movement, right? Like we have all of
Right.
these people who are eating, but they're nutritionally deficient. So then that leads to decay issues because if we don't have vitamin D and K and vitamin A for remineralization to carry our calcium, you end up with bone loss and decay.
And if your gut isn't healthy, you're not going to absorb any of it.
Correct.
The
Yep.
end. Well, the end.
Well, this is a real good taste of all of
Yes.
the conversation
Events.
we're hoping to have.
Okay, you mentioned one of the podcasts that you listened to while you were doing some commuting, working for your DSO. But what are some other podcasts that you, or even podcast guests, not guests, hosts, you would love to see us be able to get on our podcast?
Ooh. So I really want to make sure that we're tapping into some of the current doctors in the field. I want to get into airway. So Dr. Engelman is amazing
Yes.
in the airway space. I think it would be really cool. Andrew Huberman keeps talking about the oral systemic connection. Shout out. Let's have a conversation. Let's dive a little bit further beyond strep mutans. I would love to
Yes.
see that. And then I think we do need to have like myofunctional therapists. And I just
For
want to
sure.
cover. And there's some really great hygienists in the functional realm, like Barbara Tritz would be wonderful.
Right.
And my mentor for the IOMT would be wonderful as well to have her come in. She's like the microscope queen. So Fran Horning would be
Oh,
one
yes.
that I would love to have a conversation. She has a really unique journey into that. But I'd like to invite more of the people thinking in the functional space, but I would love to have some more of the doctors. I love Dr. Drew Pruitt. Like I listen to him a lot. He's got like some functional doctors. I would love to tie the holistic side of both dentistry and medicine. What about you? Like who do you think would be awesome to have on the podcast?
Gosh, okay, I have a list, but I do think now that like as we were kind of talking through things, I don't see the functional space being a place that would ever accept an assistant to do a hygienist job at all. Like, I
Mhm.
don't see those doctors ever being like, oh, good enough. Like, that's just not the type. That's just not the type at all.
No?
But okay, I would love, so here in Utah, we have a couple functional doctors that are like locally famous, I guess. So Dr. Thomas Hemingway, he's pretty fun. I had Huberman as well. Dr. Hyman would be amazing to have on. And I do actually listen to a podcast called Test Don't Guess, but it's more the HTMA testing, which is hair tissue mineral analysis, which that is something that I would also love to incorporate into like a salivary test with all the things that you can test there. Well, this kind of tells you what is your body deficient in. So I really love that one. So I would love to marry those two, obviously with the gut health. So they're one of my favorites to listen to. Living Well with Dr. Michelle. She
Mhm.
is down in American Fork and she has a really cool practice. If I lived closer, I would try to work there, but I am not commuting an hour and a half to work. That traffic is nonsense down south. Not happening. And then of course, I live in Utah, so Carolyn Call of Just Ingredients, she just like speaks so plainly about ingredients and like her nutrition background and her story of cancer and her family story of cancer. And it was the physicians that were the ones that were starting to tell them, stop cooking on Teflon, stop like eating off of plastic, throw out your underwear, like make all these changes because you just didn't realize, none of us realized all these toxins were around us. It was just marketing for years. So she was definitely one of the ones, so I started following on Instagram, just becoming aware of ingredients and making those better choices and really just trying to get down to simple ingredients. So anyway, all that to say, those are the ones I would love to see. And honestly, even my functional nurse practitioner, I would love to have her on because she has a pretty cool story as well. So I think we have a lot of material for sure.
Oh, yes. I'm excited for this journey. Should we explain how this all came about?
Go for it. Go for it, Heather.
Yeah, so you and I met through Guru Nanda, essentially. Actually, did we meet through Guru Nanda or did we meet through Bristol? A little bit of both, I think.
Not technically. I heard of you through Guru Nanda. I technically got to take your place.
Yes.
Guru Nanda,
Yes,
thank
you
you.
did. Yes. You're welcome.
Great.
Yeah. It, yeah, I think we met at under one roof. I was at the Bristol booth and you were at
Oh yeah.
the Guru Nanda booth. And I think I think the Guru team was like, you gotta meet Heather, you're doing the IOMT thing. And so that was the first time we met. And then we met again in Chicago just recently, and then decided that we were going to do some biofilm babbles with each other and Noriana.
Which really was kind of like a professional study club, very unofficial study club of like, okay, we all have very different things that we can help each other with. And I don't think you and I realized how much we did have in common.
Yeah.
Microbiology, of course, being the foundation for that.
Yeah.
Even though I don't love perio. Um, that definitely was like, this could be a really fun thing to talk about because we love the functional side. It just makes so much more sense.
Yeah.
It just does to us anyway.
And I've leaned on you for the support because I need to speak.
You do. You do
So
need to speak.
I'm just sort of a baby in the speaking world. So
I also am very
I
much a
need to,
baby.
but
Speaking
it's
world.
just nice to have a mentor to have some people kind of just in your corner, like
Yeah.
me being able to throw my slides at you and you'd be like, yeah, you can do this. And whoa, that's a lot of material. You gotta like dial it back. So, but yeah, so I just think it's amazing. God puts us in the space with the people that we need to be connected with and supporting and bringing each other up. And then you were like, "Hey, I want to do a podcast with the IOMT.
Yes. Yes.
How do you feel about hosting? Because we're both members. Like, I think you would be a cool host." And I was like, "Yeah, I think that would be fun. But why don't we just do it on our own?
Let's just
We're
do it.
not
Yeah.
under the parameters of a body,
Yes.
it's going to give us limits." And I love the IOMT, and we're definitely going to have guests
Oh,
from
for sure.
that space and IABDM and hopefully AHASH and some of those other bigger groups. But
Wait, what is IABDM? Do I
not
know that one?
International Academy of Biologic Dentistry.
Oh, okay.
Yeah. And then the oral systemic group is AHASH. I don't remember what the initials. I'm just so used to throwing
Yeah.
initials out there. But definitely
I know.
Academy of Oral and Systemic Health.
Yes.
Yeah. Yeah. So,
Yes.
yep. Which I took classes for in Chicago, and that was kind of part of my inspiration of just becoming more independent because Laura Hooper was talking, and she's working with cardiologists, and they were talking about how she's working with a cardiologist and they've reduced all cardiac events in that practice by treating the oral microbiome. And I was like, "Oh, this is so cool. This is my jam." So
Only.
she inspired me. So I've listened to her quite a bit. Definitely over the last almost 3 years working with Bristol, I've just enveloped a whole lot of information. I read a lot of research. So it's fun.
You do. You're quite literally ground zero for so many things. And I remember the first time, gosh, this is probably like 4 years ago, that I had even talked about doing salivary testing. I think my doctor was like, "Yeah, but aren't you going to treat it the same no matter what?" And at the time I was like, "I guess so. I don't know." Like this was still chlorhexidine days for me, okay? So I was just like, but clearly that's not like working. So like maybe if we test, we have more information, we can try different things. But I didn't know the right answer. And I'm excited to learn on this journey and definitely something I hope that we're able to empower the hygienists listening to this podcast. I want to give them more information on how they can up their clinical game if they want to, of course.
Mhm.
But I would like to think if you're listening to our podcast, we're not that entertaining. This is more informational for sure. But even on the patient side of things, if you're a consumer, this is something that you can ask your provider for, is salivary testing.
Mhm.
Consumers are driving so much. I've noticed this huge trend. I've had my 1 year anniversary with Guru Nanda, and at the CDA, 1 year versus a year later, the conversations are completely different. And even in California, like the consumer, the amount of doctors I have come up and say, moms want clean ingredients.
Yeah.
Moms, like the moms in my practice would love this. That those types of things, it's the consumers that are driving this. And unfortunately, that's what it's going to take to get us to clean up our act. Oh my gosh. Well, here.
And that's the cool thing too, is Bristol started consumer forward.
Yes.
And as a coach, I'm able to have conversations, not through Bristol, always like my independent. I will advocate like this, you're high risk for X, Y, and Z. So these are the things you could advocate in your dental practice. And if you give me permission, I'd be happy to reach out to them and show them like this is what her test is saying or his test is saying. And maybe a laser bacterial reduction would be a benefit for this person. Or you could incorporate something like periopatect trays or desiccation therapy to help reduce the pathology. And if there's no pathology, like let's start looking at some other things that we can help with this patient. Like maybe periostat's a great option for someone who has low bacterial risk, but they're still progressing with disease to deal with the host component. So I get the chance to like teach. And how cool would it be for you as a hygienist to be like having a patient sit in a chair and be like, I had this microbiome test and my coach said it might be a good idea for you to use a laser today. Slam dunk for the office, I think.
Yeah, when patients get to drive that conversation, heck yeah.
Yeah. So I think dentistry is changing. You're right. And the patients are going to start pushing to advocate for as we educate more and as we educate more hygienists and doctors and practitioners about the importance of oral care. I think other people are going to start
I
pushing.
will be the naysayer on this because there's definitely those patients that just are not on this par. Like
Oh
they
yeah.
just don't care. And you can give as much education as possible. And they're still just like, I want what my insurance covers. And you're just like, so
Yes.
you want to lose your teeth. Cool.
And
Okay.
you
Run
know
that.
what? That's okay. I always used to say I'm not your practitioner then.
Yeah.
Like that's perfectly fine. I might I had such a busy schedule, like I might not be the right person for you. And that's okay.
Right.
Yeah. I mean, yeah, you're right. There are some people who just want to go by the insurance parameters, which insurance
Which
doesn't.
we all cringe so hard. We're just like,
They're
that's
not
my
providing
dream
health.
words. Yeah. Yeah.
Yeah.
Like,
That's a
oh,
whole
I
nother
love
topic.
doing the bare minimum. Thank you for
Yeah.
helping me do that. I love
Right.
that.
Yep. Yep. Oh, perfect. Should we wrap up?
We should wrap up. Okay, are we doing this? Is this our closing phrase? The what does the functional roots mean to you personally?
Ooh, the functional roots to me personally, I'm passionate about teaching other people about looking outside the box. So I'm hoping that functional roots will be us opening the minds of individuals, whether it's patients, practitioners, anyone listening, to think outside the box of what you were taught and know that there's other ways and other things we can look at and be open-minded. I think open-mindedness is super key in all walks of life. So what about
Agreed.
you? What does it mean for you? What does functional roots mean for you?
I love yours. I'm not going to steal it though. I've been a hygienist 18 years and I can tell you probably the last 14-ish years, like I kind of shared, it was just going through the motions of what does this office want me to be to succeed here, right? Like that's the reality in a private practice is you've got to fit a specific parameter for what that practice model is. And between getting to work for a DSO, not having a dentist hound me for whatever dumb thing, I didn't take a perfect IO, even though I am phenomenal with my IOs. Um, and getting to grow through RDH under one roof and just the professional community that I've had the pleasure to get to be a part of. I mean, Hygiene Elevated, they're not functional, but it helped me discover this passion I didn't know I had. And that's really been the most encouraging thing. And so I think the functional roots aspect, we still are passionate about patient care.
Mhm.
And we want to, I think, be able to give other hygienists, hopefully, a passion. I think that there's been so much woo woo nonsense around the alternative space, and maybe there's been weird stuff here or there. But once you start walking in it, you see that, oh my gosh, there is a whole different side to this that I could not have possibly thought to be true. That, I mean, there may not be a ADHA or ADA sponsored link attached to it, but guess what? It's very real in the real mouth, and there's testing to show it, and there's patients that experience it, and that's not an undeniable fact. So I think the functional roots is really just giving inspiration and encouragement to other dental providers that are just looking for a passion and looking for something more and looking to be just a next level provider and really have some sort of newfound passion for dentistry.
Yes. Amen.
So that's my answer.
Yeah.
All right. It's going to be fun, and we're excited to definitely get to bring episodes to you guys. So if you have suggestions of topics that you want to hear about, please comment on our social media. We would love to hear things and get suggestions from you guys. But like and share. That's what you're supposed to say at the end of a podcast. Please like and share so we can spread the word, so that we can grow and that we can get these amazing guests on that we're hoping to. Dr. Huberman, for sure.
Yeah.
I mean, I'll take Gary Brecka. I love Gary Brecka. Like, he is such a data-driven person. I feel like
yeah,
we wouldn't talk the whole time. We would just listen to him talk.
Oh, yeah. Yep. For sure.
Uh-huh.
I could add him to my list too.
I would add that. All right. Until next time, thank you guys.
All right. Ciao.